Essentially, brain fogs or clouding of consciousness is a hazy state where one is slightly less aware or awake than usual, with a diminished awareness of time and surroundings. Traced back to Georg Grainer's definition in 1817, the concept is integral to understanding delirium, a condition described in the Diagnostic and Statistical Manual of Mental Disorders, DSM. The DSM replaced the original term with disturbance of consciousnesses for practical application, but essentially, they refer to a similar idea. It might be less severe than total delirium, aligning more with subsyndromal delirium defined by some subtle but important differing features such as less severe symptoms, a stable sleep-wake cycle, and stable sleep-wake cycle and stable motor alterations, among others. Although it doesn't fully evolve into delirium, subsyndromal delirium is still severe, especially in intensive care settings. Patients with this condition tend to require extended care at a high rate, though not as the same level as full delirium, and may have lower post-discharge independence in comparison to the general population, but still more than full delirium patient. Unfortunately, no current standard test is both exclusive and specific to this condition. Making diagnosis contingent on the physician's subjective discretion, it often gets categorized under cognitive disorder, not otherwise specified. This concept of consciousness clouding reflects an interesting brain model where one part regulates overall consciousness, which is in turn responsible for self-awareness and environmental awareness. Various causes can disrupt this regulator, thus affecting the overall consciousness level, however. This doesn't imply drowsiness. The affected person can be fully awake but clouded in consciousness, leading to a unique situation where they feel awake, but in another way, not. Lepowski notes, a decrease in wakefulnesses can lead one toward a coma, not sleep, quite a major difference. The story delineates the lived experiences of individuals dealing with cognitive impairments, often described as functioning in a state of brain fog. It paints a picture of mistrust in personal judgment, a non-linear perception of time, and heightened confusion, although these symptoms may bear resemblance to depersonalization or dreamlike states, they are distinct. The narrative highlights how brain fog might hinder everyday cognitive activities, including perception, memory, learning, language proficiency, motor skills, and mental agility. Primarily, though, it underscores the significant impact of brain fog on attention span, understanding, thought processes, and language abilities. Malfunctions vary in severity, with most sufferers reporting a hazy mental state, forgetfulness, and disorganized thinking. Despite the semblance of similarities, mild cognitive impairment and subsyndromal delirium are characterized differently, where the former exhibits dementia, like impediments that do not involve arousal disturbances. The concept of brain fog is presented as a fluctuating, subjective cognitive dysfunction that interrupts the smooth execution of daily tasks. Interestingly, brain fog is prevalent among patients battling chronic pain. Pain management in such cases might consume significant cognitive resources, consequently reducing the brain's operational efficiency. For instance, up to 75% of fibromyalgia patients suffer from a specific form of brain fog affecting concentration, memory, and multitasking abilities. Substantial differences are noted in inhibitory control, memory, and processing speed when compared with healthy individuals. Remarkably, there's a striking similarity between symptoms of fibromyalgia and attention deficit hyperactivity disorder, ADHD. A joint screening for both is often suggested due to their overlapping manifestations. Alternatively, it is theorized that heightened pain might be hindering attention systems, consequently leading to cognitive issues. Similarly, in the case of chronic fatigue syndrome or myalgic encephalomyelitis, the narrative points out the presence of cognitive dysfunction or brain fog in the CDC's diagnosis criteria. What unfolds is a comprehensive study of cognitive impairment's impact and pervasiveness in various illnesses, emphasizing the complex nature of brain fog and its effect on everyday life. The uncertain impact of mold exposure on neurological health continues to prompt ongoing debate due to a lack of supporting research and data. More in-depth study in this subject area is urgently required to clarify this controversial issue.